Hi, and welcome to the informational video series on the rules for registered family. This is video number 7, furniture, equipment, outdoor play, illness, injuries, medication, and children with specific needs. My name is Terry Hansen. I work for the Child Care Licensing Division as a licensing specialist in the Eugene Medford unit. The Child Care Licensing Division hopes that you find these videos informative and supportive in learning about the new Registered Family rule set. During each video in the series, we will explain some of the key features and highlights of the Registered Family rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Registered Family Rulebook for the full list of requirements and rules. Okay, let's get started. Now let's review the updated guidelines regarding the use of tools that pose a safety risk, such as glue guns, irons, and other similar items when working with preschool and school-aged children. New rule now allows for the use of tools like glue guns, irons, and other tools for preschool and school-aged children. However, these tools must only be used under very specific conditions. Children must receive clear instructions on how to use the tools safely. This includes demonstrating proper handling and explaining potential dangers, and the use of these tools must be closely supervised by a caregiver at all times to prevent accidents or injuries. Children must be within arm's reach of you and never be left alone with these tools. By following these guidelines, you can help children safely engage in creative or learning activities that involve tools while minimizing the risk of injury. It's important to remember that supervision and safety training are key to using these tools in a safe and responsible manner. Let's go over some updated rules regarding outdoor play equipment and safety practices for home childcare settings. Trampolines are not allowed for childcare children to use except for rebounders, which are required to be used according to the manufacturer's instructions. Rebounders are smaller, individual trampolines that are safer for one child to use at a time. Regular-sized trampolines pose significant risk for injury due to the potential falls or collisions, so it's important to ensure safe alternatives are used. Play equipment may not be used on pavement or other hard surfaces when the equipment is over 18 inches in height. Climbing structures or slides that are too tall can increase the risk of injury when used on hard surfaces. To ensure safety, it's required to place taller equipment on softer surfaces like grass or rubber mulch to help cushion falls. To promote safety during active play, it is strongly encouraged to have children wear helmets when using any bicycle, tricycle, balance bike, kick, scooters, skateboards, or roller or inline skates. Helmets help reduce the risk of head injuries, so make sure you encourage children to use helmets and have them available for use when participating in these activities. By following these updated guidelines, you can help ensure that children in your care have safe, fun, and engaging outdoor play experiences while minimizing the risk of injury. Now let's go over some important updates related to sick child exclusions, allergy care plans, and the use of EpiPens. The rules now include updated exclusion guidelines based on specific symptoms, and these guidelines have been aligned with the recommendations from the Oregon Health Authority and Oregon Department of Education. These updates help ensure that children who show symptoms of illness that could pose a risk to others are kept home to recover, preventing the spread of illness in the child care environment. If an EpiPen is used on a child, the CCLD must be notified by 5 p.m. of the next business day. This is important for tracking and responding to potential health risks in childcare settings. Ensuring that EpiPen use is reported promptly helps maintain accurate records and allows for appropriate follow-up to safeguard the child's health and safety. By following these updated guidelines, you'll help create a safer environment for all children by making sure illnesses are properly managed, allergies are addressed, and any health incidents are promptly reported. Next, let's review the updated rules related to serious injury and incident reporting, as well as first aid kit requirements. Any serious injury or incident must be documented with a report. The report must include the signature of the parent indicating that they've reviewed the report or received a copy within 48 hours of the incident or injury occurring, and should be maintained in the child's file. An email or text with confirmation of receipt will count as a parent signature. This ensures clear communication between you and the child's parent and allows for appropriate follow-up. The updated rules now include a dislocated bone as part of the serious injury category. If a child experiences a dislocation, it must be documented and reported as a serious injury. There have been some important additions to the first aid kit requirements as well. By ensuring these reporting requirements and first aid kit supplies are in place, you'll be prepared to handle any emergencies that may arise and provide accurate documentation and follow-up for the children in your care. Now let's talk about some important updates regarding medication, authorization, and administration of non-medical items in the child care setting. For children with chronic medical conditions, you may now receive up to 12 months of permission to administer medication related to their condition. This makes it easier for you to continue providing necessary care without requiring constant permissions. You can now get over-the-phone permission from parents to administer a single dose of non-prescription medication. This provides more flexibility for handling situations where a child may need something like a pain reliever or allergy medication on a one-time basis. The permission should be documented and include who you received permission from, what time, and what medication was given. All medication must be stored under a child safety lock to ensure that it is inaccessible to children. This helps prevent accidental ingestion and ensures the safety of the children in your care. Emergency medications such as an EpiPen or inhaler must either be inaccessible to children or with you to ensure it's readily available during an emergency, but maintained out of children's reach. Now you have the option to receive annual authorizations from parents for the use of non-medical items like sunscreen. For these non-medical items, you no longer need to document the application of sunscreen or diaper cream, making this process more streamlined. The rule previously prohibited the use of aerosol sunscreen has now been removed, but remember, sunscreen must always be applied according to the manufacturer's instructions. Finally, it's important to note that medication cannot be administered after its expiration date. Be sure to check the expiration dates regularly and remove any expired medication from the child care home.
These changes are meant to make medication management and the administration of non-medical items easier, while ensuring the safety and well-being of the children in your care.
Thank you for watching this video in our informational series. You can now move on to the next videos in the series. If you have any questions, please contact your licensing specialist for more information. Visit our website at www.oregon.gov/DELC.